What test detects cervical cancer early? Pap smear. Correct. And what does it do? It checks for abnormal cervical cells. Which contraceptive prevents STIs? Condom. Correct. The condom reduces infection transmission. What is painful menstruation called? Dysmenorrhea. Excellent. Dysmenorrhea is the medical term for pain during menstruation. It can range from mild to severe and is a common concern for patients.
What is absence of menstruation called?
Amenorrhea.
Correct. Can you explain?
No menstrual flow.
Excellent. A key clinical term.
What causes most cervical cancers?
HPV.
Correct. HPV infection can lead to cervical cancer. Which hormone causes ovulation? LH. Correct. LH releases the egg from the ovary. Remember, LH is key for ovulation. What is excessive menstrual bleeding called?
Menorrhagia.
Correct. And what does that mean?
Heavy menstrual bleeding.
Exactly. Heavy menstrual bleeding. Good job.
What is a uterine fibroid?
A uterine fibroid is a benign uterine tumor. It's a non-cancerous growth in the uterus.
Excellent. That's correct.
What is the main symptom of PID?
Pelvic pain.
Correct. Pelvic pain. And as a reminder, lower abdominal pain is common. What is pregnancy outside the uterus called?
Ectopic pregnancy. Correct. And what's the explanation?
The fetus grows outside the uterus. What is inflammation of the vagina called?
Vaginitis.
Correct. Vaginitis is an infection or irritation of the vagina. Remember to always advocate for your patient. What is the normal reproductive age of menopause?
45 to 55 years.
And why is that?
Menstruation permanently stops at this age.
Excellent. What is the surgical removal of the uterus called?
Hysterectomy.
Correct. And that is the removal of the womb. What is the common symptom of ovarian cyst?
Pelvic pain.
Correct. Pelvic pain. Cysts can cause lower abdominal pain. What is white vaginal discharge called?
Leukorrhea.
Correct. And what is it?
Whitish discharge from the vagina.
Exactly. Well done. What is the primary symptom of anemia?
Fatigue.
That's correct. The reduced oxygen carrying capacity causes weakness and tiredness. What is failure to conceive after 1 year called?
Infertility.
Correct. Infertility. It is the inability to become pregnant. Which organ produces ova?
Ovary.
Correct. The ovary produces female eggs. What is inflammation of the cervix called?
Cervicitis. Swelling or infection of the cervix.
That's correct. Well done. What is the outer opening of the uterus called?
Cervix.
Correct. The cervix is the lower narrow part of the uterus. It's an important part of the female reproductive system. What infection commonly causes curd-like vaginal discharge?
Candidiasis.
Excellent. And what's the explanation?
Yeast infection causes thick white discharge.
What is removal of the ovary called?
Oophorectomy.
Correct. Oophorectomy is the surgical removal of the ovary. What is painful sexual intercourse called?
Dyspareunia.
Correct. And what's the explanation?
Pain during intercourse.
Excellent. That's correct. What is the monthly release of an egg called?
Ovulation.
Correct. Ovulation is the release of an egg from the ovary. What is the inner lining of the uterus called?
Endometrium.
Correct. And what happens to it?
The lining sheds during menstruation.
What is cancer of the cervix called?
Cervical cancer.
That's correct. It's a malignant growth of cervical cells. What is infection of the fallopian tube called?
Salpingitis.
Correct. And what does that mean?
Inflammation of the fallopian tube.
Excellent. What is the female hormone responsible for secondary sexual characteristics?
Estrogen.
Correct. And what does estrogen do?
It develops female body features.
Excellent. What is the cessation of menstruation called?
Menopause.
Correct. Menopause is the permanent stopping of menstruation.
So it's a natural part of aging?
Exactly. What is the medical term for scanty menstruation?
Hypomenorrhea.
Correct. Can you explain what that means?
It's very light menstrual flow.
What instrument is used to examine the cervix?
A speculum.
Correct. It helps visualize the cervix. Good job, everyone. Let's review the steps. What is the medical term for no ovulation?
Anovulation.
Excellent. And what is an ovulation?
It's the failure of the ovary to release an egg.
What is the female reproductive organ where the fetus develops?
The uterus.
Correct. The uterus, also called the womb, supports fetal growth. What is inflammation of the vulva called?
Vulvitis.
Swelling or infection of the vulva. Exactly. Vulvitis. Good job.
What is abnormal tissue growth outside the uterus called?
Endometriosis.
Correct. Endometrial tissue grows outside the uterus. What is the lower part of the uterus called?
Cervix. It connects the uterus to the vagina.
Correct. Excellent answer. What is the main female sex hormone after ovulation?
Progesterone.
Correct. And what does it do?
It prepares the uterus for pregnancy.
Excellent. What is the medical term for irregular menstruation?
Metrorrhagia. Bleeding occurs between periods.
Excellent. That's correct. What is the tube carrying ova to the uterus called?
Fallopian tube.
Correct. The fallopian tube transports the egg to the uterus.
What infection is commonly called yeast infection?
Candidiasis.
Correct. Candidiasis. And what causes it?
Candida fungus.
Exactly. Caused by an overgrowth of Candida fungus. What is the examination of the pelvis called?
Pelvic examination.
Correct. And what does it assess?
Assessment of female reproductive organs.
Excellent. That's a key assessment. What is the medical term for difficult childbirth?
Dystocia.
Correct. And what does it mean?
Abnormal or difficult labor.
Excellent. What is excessive growth of uterine tissue called?
Hyperplasia.
Correct. Hyperplasia is the thickening of the uterine lining.
Thank you.
What is the surgical removal of both ovaries called?
Bilateral oophorectomy.
Correct. And what does that mean?
Both ovaries are removed.
Exactly. Well explained.
What is inflammation of the uterus called?
Endometritis.
Correct. Can you explain?
It's an infection of the uterine lining.
Excellent.
What is a fluid-filled sac in the ovary called?
Yes, in the front row.
Ovarian cyst. Correct. An ovarian cyst is a sac containing fluid in the ovary. They are quite common and often harmless. What is the first menstrual period called?
Menarche.
Correct. Menarche is the beginning of menstruation. It's a key milestone in development. Remember this term for your exams.
What is the absence of menstruation after menopause called?
Postmenopause.
Correct. Postmenopause. It's the stage after menstrual periods stop. What condition causes multiple ovarian cysts?
Polycystic ovary syndrome.
Correct. And how would you explain PCOS?
It's a hormonal disorder that affects the ovaries.
Excellent. What is the visual examination of the cervix called?
Colposcopy.
Correct. Colposcopy. A special instrument examines the cervix. What is the muscular canal leading from the cervix to outside the body called?
Vagina.
Correct. It is the passage connecting the uterus to the exterior. What is removal of the fallopian tube called?
Salpingectomy.
Correct. Salpingectomy is the surgical removal of a fallopian tube. What is inflammation of the ovary called?
Oophoreitis.
Excellent. And what causes it? Infection or swelling of the ovary? Perfect. What is the narrowing of the vagina called?
Vaginal stenosis.
Correct. And what does that mean?
Abnormal narrowing of the vaginal canal.
Excellent. What is the female reproductive cell called? Ovum.
It's the female egg cell.
That's correct. Ovum is the female egg cell. What is inflammation of the breast called?
Mastitis.
Correct. Mastitis is a breast tissue and it often occurs in prednisone due to blocked ducts or bacteria treated into a cream. All right, class, let's review. What is the surgical repair of the vagina called?
Vaginoplasty.
Excellent. And what's the explanation?
Reconstruction of the vagina.
Perfect. Great job. What is the common symptom of uterine fibroids?
Heavy bleeding.
Correct. Heavy bleeding. Fibroids often cause excessive menstruation. This is a key point for patient care. What is bleeding after menopause called?
Postmenopausal bleeding.
Correct. It is bleeding that occurs after menopause. What is the surgical removal of the cervix called?
Trachelectomy.
Correct. And what does it involve?
Removal of the cervix.
What is abnormal vaginal bleeding called? Dysfunctional uterine bleeding? Correct. It's irregular bleeding from the uterus.
What is the instrument used for pap smear collection called?
Spatula. Correct. And what is it used for? To collect cervical cells.
Exactly. What is the medical term for fear of childbirth?
Tocophobia.
Correct. Tocophobia is the extreme fear of pregnancy or labor.
Thank you.
What is the cancer of the ovary called?
Ovarian cancer.
Correct. Can you explain?
Malignant tumor of the ovary.
Excellent.
What is the hormone produced after ovulation?
Progesterone.
Correct. And what is its function?
It supports pregnancy and the uterine lining.
Excellent. That's key. What is dryness of the vagina commonly caused by?
Low estrogen.
Correct.
And it occurs commonly after menopause.
This is important for patient care. What is infection of the uterus and tubes called?
Pelvic inflammatory disease.
Correct. It's an infection of the reproductive organs. What is the inability to carry a pregnancy to term called?
Habitual abortion.
Correct. And can you explain what that means? It means repeated pregnancy loss. Excellent. What is the medical term for removal of the breast?
Mastectomy.
Correct. Mastectomy is surgical breast removal. Understanding this term is crucial for patient education. What is the common screening method for breast cancer?
Mammography.
Correct. And what's the explanation?
It's an X-ray examination of the breast.
Excellent. What is the female birth canal called?
Vagina.
Correct. And what's its role?
It's the passage used during childbirth.
Excellent.